where you look into sort of genetics is that you've got the family background. So, the classic one, 20 years ago, if we had a child who was developing myopia sitting in our chair, you were almost guaranteed that the parents were myopic as well. Fast forward to nowadays, I've got lots of parents who are coming in where there is no history of myopia, yet the child's becoming myopic. And so you kind of go, it is absolutely a mixture of that inheritance, but also environmental factors. And, we've discussed in the past, we know that there is a higher incidence of myopia in East Asian cultures, is it environmental because of lifestyle, cultural differences, large populations built in built environments, or is it genetic? But pretty much across cultures, there's been an increase in the prevalence of myopia over generations. So absolutely a combination of the two.
Yeah, I don't remember the exact statistic, but I think that they think that, within the next 10, 20 years, maybe half the population of the
Yeah,
world is going to have
predicting.
myopia.
Yeah, 2050 was the kind of marker that 50% will be short-sighted.
Mm.
Yeah. And I think Australia recently has been sitting around that sort of 27-30%, which is where America was in the 70s. They're now at the sort of over 50%. So it's certainly sort of changed over time. And um, you know, outdoor, it's interesting when you talk about, look at relationships in research, that we often talk about correlations and relationships and associations, because it's very difficult to talk about cause. It needs a very, very high level of scientific proof for a researcher to be able to kind of state that with confidence that something's a cause. And myopia is one of those areas in vision care where they're pretty confident in saying that spending more time outdoors delays short sight, and that the lack of outdoor activity is a cause of early short-sightedness development or myopia development.
And outdoor time, that's, you were speaking about that, but when it comes to UV, like UV light, does that have any in itself? Does that have any like beneficial effects for myopia, like
It's a great
reducing myopia?
question. Yeah, and that's a great question. What is the benefit of spending time outdoors? Is it the overall volume of light that's available? Is it the UV that's protective in some way? Is it I saw one paper years ago that I think makes a lot of sense, that when you're in an indoor environment, you have a lot of light reaching you from very close distances, walls and roof, that you don't get exposed to outside. If your brain's affected, your retina is affected, a little bit of brain tissue, that it's averaging where that light is coming from across the day as a potential trigger for short-sightedness. And so you've got all these close distances, and so maybe it's an adaptation to that. And that the benefit of outdoor activity is that you have this more natural light coming from further away. So lots of theories we still don't know, and that's that tension as a clinician to say get outdoors but still be sun safe, and you're kind of going, well, is the UV increase part of the magic? We just don't know. It's the challenge.